When we say charge on, we commit to do extraordinary things, to put in the work, to be smarter and stronger, to let them know we're coming. Charge on! Charge on!
Good day, everyone. Welcome to the Research, Recovery, and Rescaling webinar. I'm Susan Vernon Devlin, Manager of Communications and Marketing at Rosen College of Hospitality Management, and I will be your moderator today. First, a little bit of housekeeping. Attendees, we will not be using the chat feature for this webinar. We will only be using the question and answer feature. So throughout the webinar, please do include your questions in the webinar feature for the question and answer, and we will get to them as we proceed throughout the webinar and at the end. If you have a question that you ask that is similar to another question, we may not respond to your question as we would have already addressed it. If we don't get to your question during the webinar, rest assured we will try and contact you after the webinar in order to answer your question in full. And now, without further ado, I would like to introduce you to the Dean of Rosen College of Hospitality Management, Dr. Yucheng Wang, who will introduce our presenter for today. Dr. Wang.
Thank you, Susan. Good morning and greetings from the UCF Rosen College of Hospitality Management. Today is July the 15th, 10 o'clock Eastern Standard Time, 2020. A lot of sunshine in the sunshine state of Florida. I hope that you can come and enjoy this sunshine with us, but realize that it is not realistic under the current situation. But thank you very much for joining us today for the fourth industry seminar focusing on industry academia partnerships and implications for the hospitality industry during COVID-19. These seminars are designed to help the hospitality and tourism industry retool for the changes we are anticipating as our industry emerges from the effects of the COVID-19 virus. Again, my name is Dr. Yucheng Wang. I'm Dean of the UCF Rosen College of Hospitality Management. Usually research starts with a question. So any participants today, if you or your organizations have a question, we can help you find an answer. So later in the presentation, we will share information about how to start this collaborative process. Today's presentation is a collaborative effort between UCF Rosen College and UCF Psychology Department. So now I would like to invite my colleagues, Dr. Cynthia Mejia, who is an associate professor at UCF Rosen College of Hospitality Management, and Dr. Mindy Ross, associate professor with the Department of Psychology at UCF, to begin the presentation. Should you have any questions or for the presenters today, please submit them through the Zoom question platform as announced earlier. And our moderator, Susan, will deliver the questions to the presenters on your behalf. So thank you again, and please enjoy the presentation. So Cynthia and Mindy, you can take over now. Thank you.
Great. Thank you, Dr. Wang, and welcome everyone. Thank you for joining us today. My name is Cynthia Mejia, and I am an associate professor and the interim chair of the Department of Food Service and Lodging Management at UCF College of Hospitality Management. Together with my colleague, Dr. Mindy Ross, an associate professor of psychology at UCF in the Industrial Organizational Program, it's also known as IO Psychology, we will present our topic, an interdisciplinary approach to COVID-19 impacts on hospitality industry workers. So let's get started. This presentation today is part of a series of interdisciplinary projects from a larger research team who include Dr. Kristen Horan and Dr. Steve Jex from IO Psychology, and our very own Dr. Deborah Brighter-Terry of Rosen College. This team also includes graduate students in IO Psychology, Jenna Beltramo, Catherine Ciarlante, Amanda Grinley, Michael DeStasso, Justin Lee, Rebecca Pittman, Moses Rivera, Daniel Dow, and Radhika Singh. On our agenda, we'll first discuss the formation of this research and our interdisciplinary collaboration. Then Dr. Schoss will give a background on the Sunshine Education and Research Center, which is called the ERC, and the UCF Targeted Research Training Programs called the TRT, which is housed in the Department of Psychology at UCF. Next, Dr. Schoss will share our early findings on the impact of COVID-19 on the hospitality workforce. I will then present some early findings on a Service Workers as Heroes project, and we will then conclude with a brief discussion on industry academic collaborations during COVID-19 and then the ways that you can be involved. The hospitality and tourism discipline can be characterized as broad and diverse, expanding over multiple sub-disciplines, what we call interdisciplinary. And there are core disciplines, including hotel and lodging and food and beverage and other related disciplines such as events, gaming, attractions, etc. And in our research, we often borrow theories from other disciplines, especially from business, such as marketing theory and consumer behavior theory. We borrow theory from the fields of sociology and from psychology, and we do this to test models to explain phenomenon. This multidisciplinary approach to our research expands the boundaries of our understanding of a problem and also how to approach and solve these problems, especially when we can work directly with researchers from other fields, and in this case, with our colleagues in IO psychology at UCF. So now I will turn the presentation over to Dr. Schoss, who will give us the background on the funding and begin presenting some of our early results.
Thank you, Dr. Mejia. The work that we will share today is part of the Sunshine Education and Research Center, which is funded by the National Institute for Occupational Safety and Health, or NIOSH, which is part of the United States Center for Disease Control. The National Institute for Occupational Safety and Health funds several education and research centers across the United States in order to promote education, research, and outreach in the areas of occupational safety and health. Our specific education and research center is called the Sunshine Education and Research Center because the focus is on the Southeast region of the United States and Puerto Rico. It is housed at the University of South Florida, but it's a collaboration amongst 4 universities: the University of South Florida, University of Central Florida, Embry-Riddle Aeronautical University, and University of Puerto Rico. This approximately $9 million center is aimed at transforming workplace quality of life through transdisciplinary education, research and practice, and industry partnerships. The Sunshine Education Research Center has a number of programs associated with it, including occupational exposure science, occupational safety, occupational nursing and medicine, as well as our program, the Targeted Research Training Program. Our program is called the Targeted Research Training Program because it focuses on using research and evidence-based interventions to address health and safety issues, specifically in the hospitality, tourism, services industries, which, as you know, is one of the largest industries in this region and has many unique health and safety challenges associated with it. We take a 3-pronged approach. First, we conduct cutting-edge research and interventions to improve workplace well-being and organizational effectiveness in hospitality. We do this with our industry partners. I say workplace well-being and organizational effectiveness together because we view these goals as very much aligned. The research is clear. Healthy workplaces are productive workplaces. Second, we provide interdisciplinary training for graduate students, including training in industrial organizational psychology, hospitality, research methods, as well as several areas of public health. Third, we provide outreach through regularly scheduled workshops, as well as through sharing our findings and presentations like these, through industry listservs, through our website, and through publications and presentations. Our approximately $1 million program is housed in the Department of Psychology at UCF, but we work closely with colleagues from Rosen College and from the entire Education and Research Center. We have a very active and engaged advisory board with representatives from industry and workers, as well as from research and policy. From the industry and workers side, we are pleased to have Chris Miller from Hilton Orlando, Mark Havard from Hyatt Regency, Eric Clinton from Unite Here, Lewis Robbins from Robbins Hotel Consulting. On the research and policy side, we're pleased to have Mo Wang, who's a professor at the University of Florida, as well as Judy Nigam from NIOSH. Before I turn to describe the results from some of our COVID research, I want to point out that although our research is funded by NIOSH through the Sunshine Education Research Center, it does not represent the official views of NIOSH, the CDC, or the US Department of Health and Human Services. Shortly after the closures went into effect in the United States, we moved to launch a study to understand how the COVID crisis is impacting hospitality workers. We are especially interested in how workers are viewing their employers in light of some of the business decisions that were made in response to the pandemic. And we're also concerned about the well-being of hospitality workers. There's a saying in industrial organizational psychology that the people make the place. And given that hospitality is inherently a people industry, the success of the industry during and post-COVID may very well be shaped by the experiences that the workforce is having during this time. And in particular, how people were laid off or furloughed may shape if they'll come back to their employers or to the industry, as well as the morale of the workforce going forward. This is an ongoing study, and I'll focus today on some indicative findings from a pilot sample of about 200 employees who we reached through Rosen College listservs and who completed our validity checks. To give you some context, the age range of our respondents was between 18 and 61, but the majority are under the age of 37. Although this is a relatively young sample, the vast majority have more than 2 years of experience in the industry, and 41% have more than 6 years of experience. As far as income, our sample is made up largely of people making less than $50,000. 74% are female, and 79% are working in the state of Florida at the time of data collection. At the time of data collection, during the week of May 18th, 33% worked in hotels, resorts, and timeshares, 9% worked in freestanding restaurants or franchises, 31% in theme parks, and 26% in other, which included events, entertainment, and sports. At the time, most were hourly paid line level employees. Also, at the time of the survey, many of our respondents were furloughed for an unknown period of time with or without benefits or laid off. Only about 10% saw no change, and 2% saw their hours actually increase. In general, our findings tell a positive story, at least in some respects. People want to remain in the industry, and maybe to somewhat of a lesser extent, to remain with their employers. About 90% see the industry as a good place to work and a top choice for future jobs. And about 80% are indicating that their organization is an attractive place for future employment and would be a good place to work again. But about 20 to 25% view that their organization has been unsupportive during this crisis in terms of showing concern for employees and providing information or help when employees needed it. A similar percentage said the same thing about their supervisor, which makes sense because people often, but not always, generalize from the supervisor to the organization. A quarter to a third expressed concerns about communication and fairness, including having enough information to handle COVID changes effectively, feeling safe to say what they felt about COVID-related changes, receiving information through official communications, and being treated fairly in decisions. These two pieces of the story are related. So people who feel that they were treated fairly and given adequate communication and support were more likely to say that they want to continue their relationships with their employers and be part of the industry moving forward. There are some differences by business type, but I'll emphasize that these are not huge differences. These are on a 7-point scale where 4 is neutral and 5 to 7 are positive, with 7 being the most positive. And as you can see here, at the time of data collection, theme parks were generally seen as more fair and more attractive places to return to. But this is not just an issue for these specific types of businesses. Across all types of businesses, people who felt that their company treated them fairly, supported them, and communicated well were more interested in staying connected to their employees and to the industry. A really interesting finding that seems to be emerging from this research is that people are factoring into their judgments whether they think the organization is resilient and whether they think it still is able to achieve its mission even during tough times. Another important finding is that a significant portion of our sample are experiencing psychological distress. Some of this does appear to be tied to how they were treated by the organization during the COVID crisis. And no doubt this is also tied to the very considerable financial, job, and health uncertainty people are experiencing, which is especially the case amongst low-income workers. I think an underlying theme here is that uncertainty is really difficult for people to handle. As humans, we do everything we can to reduce uncertainty. We search for information, we develop plans, and so forth. The COVID crisis brings a tremendous amount of uncertainty, and the stress is made worse when people feel like they may be treated unfairly or that they don't have enough information to make important decisions. We also asked about benefits. For the people who have these benefits, medical, paid sick leave, tuition reimbursement, employee assistance programs were all viewed as particularly important benefits during this period. Yet it is important to note that many people in our sample reported that they don't have access to these benefits. As far as next steps, this is very much an ongoing project where we are going to continue to follow people longitudinally as the crisis continues, and we are going to conduct a series of interviews in order to get a more in-depth understanding of people's experiences. But even at this point in the research, I think there are some very clear takeaways emerging. The first is communication is key. It's important to provide timely, accurate communication that expresses concern for employees. The second takeaway is to emphasize organizational resilience. Communicate with your employees about your business plan, or even better, include them in continuity of business planning. If it's accurate, be sure to express optimism about the business succeeding, but also provide real plans so that employees can share in that optimism. And the third takeaway is to help manage distress. As I noted earlier, people's distress is to some extent tied to their jobs and how they feel like they were treated. This is a great time to show that you care about your people. Obviously, providing benefits and income would certainly help to reduce uncertainty and anxiety. But there are other ways to help your employees manage distress even without having financial resources or knowing the answers to all the questions. And when thinking about this, it might be helpful to think about the fact that jobs are more than just income. Jobs provide community, stability, routine, access to resources, opportunities for skill development, and so forth. Even if you're in a place where you can't provide the income part, try to provide some of these other elements. For example, by creating opportunities for employees to stay connected, checking in on their well-being, and offering resources. With this in mind, our team has created a page on our website devoted to resources for helping hospitality tourism service managers, employees, and researchers to deal with the COVID crisis. For frontline employees, this includes resources related to mental health, finances, unemployment, and education and skill development. For managers, we also provide additional resources for leading during this time, including resources for managing layoffs and furloughs in a way that is most aligned with promoting well-being. At this point, I'll turn our presentation back to Dr. Mejia to share about our second major COVID-related project.
Great, thank you. In the initial weeks of the pandemic in the United States, towards the end of March, we started to observe, and even for some of us, take part in a phenomenon which showed our appreciation and thanks for essential workers. So for example, we may have watched on television how at 7 o'clock each day in New York City and many other places in the world, citizens who were under stay-at-home orders would go out each night banging pots and pans and applauding for healthcare workers, first responders, doctors, and nurses as they changed shifts. This phenomenon quickly expanded to include other essential service workers, including retail grocery employees, food service workers, truck drivers, delivery workers, etc., all paying tribute to the people who are risking their health and safety for the sake of our society. And for those of us who have worked in hospitality and the services industries, this represented a rapid ascension in status in our society. Because prior to this time period, line-level service workers were typically low-paid, hourly workers, and many without benefits or job security. Furthermore, line-level service workers in the United States and in other countries are considered low-skilled, disposable, and in general, looked down upon in our society. Yes, some companies do a very good job in paying good wages and giving good benefits to line-level workers, but clearly there still needs to be more work in this area. This pivot to hero status has even been leveraged in marketing campaigns. And yet alongside this ascension to hero status, there seems to be a disconnect among service workers who are generally confused or even stunned by their new status. And in some cases, they're enraged because while they're deemed heroes, they may not be earning the higher wages nor receiving those health benefits and all the other things that they believe heroes should receive. In fact, there's been a call to action to support these essential workers. And rather than giving them accolades for sacrificing their health and safety, what they want is fair wages and benefits. All right, so in this study, our team took the data from news and media sources, from prints, television, transcripts, and radio, and we examined how service workers and society think about what is known as dirty work, and for how a brief period of time, both the workers themselves and society at large came together and valued the work of grocery workers, cooks, and other restaurant workers, delivery drivers, and many other service workers. We learned that both groups saw essential service jobs as dangerous during the pandemic, and that essential service workers were still proud to serve and do their jobs and defended the work and its value. And we learned that on the other side, society, for the first time en masse, were extolling the virtues of service work and were letting go of the stigma of how dirty service work was perceived. So what does this mean? We see the coronavirus spiking again, especially here in Florida right now. And just a few weeks ago, the hero talk waned as the perception was that the virus was going away and that society could go about their business again. But now as we are spiking, we are starting to hear this hero talk again as all things become increasingly more dangerous. If hero talk can regain leverage, we will continue to hear calls for better and higher wages for service work and access to benefits. There will be a call for equity and for the value of this work and how it has always served society. And one recent issue in the fluctuating news cycles is that hero talk, as it diminished and the marches emerged, particularly Black Lives Matter, which is a very important and crucial statement on social justice. And all of these issues overshadowed the ascension of service workers heroes in the news cycle. So we'll be paying close attention to these shifts in discourses in our research is set for a second phase in the coming weeks as we continue to see this spike in the pandemic. In general, both before the pandemic and now during, we would like to call attention to the benefits of academic and industry partnerships. Just like interdisciplinary research, our academic collaborations with industry are a lifeline. We can help each other in many ways. For example, we can expand our expertise. Faculty and researchers who have been out of the industry for many years can stay up to date in partnering with industry. And likewise, industry can gain a perspective on what and how we are teaching, and what types of research and methods we use to solve these problems. Another benefit to industry is that you can outsource your research projects to academia, and we are uniquely qualified to serve you in this role. Together, we can form new ways to look at industry challenges, and together we can be on the forefront of new strategies towards these efforts. Finally, we can work together to bridge the academic and industry cultural divides as we collectively move forward on solutions for returning to work after the pandemic. And now I'll hand back this presentation to Dr. Schoss, who will offer our conclusions and ways to be involved with our efforts.
Thank you. The COVID crisis is already yielding many significant occupational safety and health challenges for hospitality organizations moving forward. These include, but are not limited to, chemical and biological exposures, having to redesign the physical workspace, workplace policies, and the work itself for safety, dealing with layoffs and furloughs, bringing back training and supporting staff, and potential guest issues such as refusal to wear masks. And those are just the issues we can foresee at the present. However, there are also what we like to call known unknowns. For example, the course of the pandemic remains unclear, but it will certainly raise new challenges and have profound effects on occupational safety and health. There are also unknown unknowns, the things that we do not know that we do not know. We view industry-academia partnerships as a critical vehicle to addressing these challenges and invite you to work with us on these issues. We also invite you to engage with us by attending our regularly scheduled workshops. Our most recent workshop focused on supporting healthy and safe hospitality work for employees of all ages. We are currently developing an upcoming virtual series that we have tentatively titled People in Isolation, Working and Non-Working. For more information, please check out our website as we regularly post updates about events and share resources. Please let us know how we can partner with you. For more information about our program, please see our website. Please also email me at the address listed on this slide. Thank you very much for joining us today. We hope that our presentation was interesting and informative, and we'll be very happy to answer any questions.
Thank you, Dr. Schoss. Thank you, Dr. Mejia, for that interesting and informative presentation. Now let's move on to the questions that we have from our attendees. The first question that we have is from Nicole. She's asking if we can share the link to the COVID-19 resource page. And I know that we do have it on the Rosen College website. You go to the home page under the research tab and you will find it there. But also, as Dr. Schoss says, you can find it on the psychology website, and we will be sharing the QR code with you as well on the website so that you can access it. Next question here. Did your research address if workers will definitely go back to their former workplaces, or will they look to other hospitality workplaces that are recovering faster?
Thank you. That's an interesting question. So we asked about people's views about returning to their workplace and to their industry, and generally how positive or negative those views are. As we start following up over time, that's something we're definitely going to look for, is where are people going? If they're returning to the industry, are they going back to their previous employer, or are they looking for a different employer, and what might be those factors, as you mentioned, pace of recovery or things like that, that might impact it?
Okay. Nicole was asking, what is the website that you referenced in the presentation? I guess I'm presuming it's the website to look at the data.
So our website, we have a website we've developed for our targeted research training program, and it provides information about the program itself, about our team members, and provides ways to work with us. It provides the COVID-19 resource page. It provides links to some of our research. As this becomes published and presented, we will certainly be posting all of that to the website so that people will be able to see that.
Okay. Someone's asking how will they be able to cite this research if they use it?
That's a great question. We're happy to see that people will be interested in using this research. I think we can add to the website some of our working paper citations. So after the presentation, we will put those on the website. That way people can go ahead and cite it, and we'll put a citation for this presentation itself.
Thank you. I have another question. How would you explain the unpopularity, unattractiveness of the hotel resorts? You provided a chart at the beginning of the presentation as opposed to theme parks.
If I could say just something quick about that, the scale was a 7-point scale. And although those images looked like there was a major spike between the types of businesses, it was around a point. So it's still very high, but in comparison to theme parks, it was perhaps 1 point lower. Dr. Schoss, if you want to add to that.
Right, that's correct. And something we'll look for also when we talk to people to try to understand what is that source, and is it a function of the communication that they got or how they were laid off, or is it something else due to the particular business and the nature of their job? I think there's a lot that still needs to be investigated there.
Thank you, Dr. Schoss. A question is being asked as to how long will you be conducting this research? Because as you can see, the COVID crisis is continuing on. It has changed its course. And from what our health experts are saying right now, it appears that this may go on for at least another year, maybe.
We've already begun discussions about using the findings from our current studies and how to position new studies. This is ongoing. We have plans for longitudinal research. And one of the things that's really important for us is early in this work, we're not able to do interviews because of the stay-at-home orders. And now, as people are finding new ways to be in contact, we can use Zoom and other types of virtual means to actually start using these findings as a basis for then developing other research questions and interacting with people and progressing forward in that way.
Okay, I think this question is probably for you, Dr. Schoss, because it deals with mental health. Do you think that the mental health of the frontline workers will have long-term negative effects of becoming essential and then possibly not sustaining that status? How can employers help?
Yeah, I think that's a very important issue. And obviously, the jury's still out with regard to this specific crisis, but if we look back at events like the recession, there were potential sort of long-term, what we'd call almost scarring effects of going through unemployment and dealing with the recession. And I think support is really key. Working with Dr. Mejia, I've learned a lot about hospitality as being a very people-focused industry. And so I think that's really where the support needs to go, that employees need to know that even if they're not working all their regular hours, even if they're furloughed, even if they're laid off, they're still cared about, they're still viewed as people, that there are people trying to help them who are interested in how they're doing. And I think that kind of social support and resources will go a long way to helping people try to recover, especially as this crisis takes its many dips and turns and bends going forward.
Well, from that question, I have a follow-up. I'm wondering, with employees not having availability of medical benefits, are there resources for them to find mental health help at this point in time, since they can't access it through their own furloughed job?
Right, absolutely. That's a key challenge right now with this crisis. But on our resources page, the Restores Clinic associated with our Department of Psychology has been running mental health programs. I believe that they are free, and they've been running a series of webinars and conferences to try to help with some of the mental health challenges. So I would recommend that folks go there, and anyone interested in more resources is more than welcome to email me, and I'll be happy to try to find some other available resources.
Thank you. We have a question from Craig. He wants to know what type of stress was measured in this study.
Good question. So we measured overall perceived stress. So that involves questions about being able to find enjoyment in things, questions about feeling that your difficulties and troubles are piling up so fast that you can't deal with it, difficulties in sort of concentrating and attention, and generally kind of feeling blue or down. So we took a very global approach to trying to measure perceived stress. Moving forward, I think we'll also look perhaps at specific dimensions and pieces of this to try to hone down on where people can use the most help and where help would have the greatest benefit.
Thank you. One of our attendees would like to know, are you doing this type of research beyond the hospitality industry, because this is affecting all industries?
Yeah, we actually have been discussing that this week, because especially in the second study, when we were looking at essential workers as heroes, we often think of healthcare workers. Of course, they're on the front lines, that and they are extremely crucial in this moment. And then our study kind of focused on essential service workers. But as we're learning and as we're reaching out and having more discussions with healthcare workers in particular, there's a merging, there's a convergence going on. And we actually have set out for our second study to take a look at the similarities and differences of how these groups traditionally viewed themselves and now are reimagining and trying to understand who they are in this moment as the heroes.
We have a question from Kate. Are there distinct differences generationally and socioeconomically regarding the perceived mental health recovery of frontline workers?
Interesting. So in terms of a lot of the ways that we think about this is just in terms of resources available to people. And we know that lower income workers tend to have less resources, right? So the fewer resources you have, the fewer resources you can invest in sort of getting help and recovering, right? The more stretched thin you are. So we do see that these type of events tend to be more harmful towards low income workers. In terms of generational differences, there's been a fair amount written debating sort of whether generations exist or don't exist, but beyond that point, clearly there are some differences that are due to age. We do find some effects of people coming out of school or starting their jobs during poor economic times or in crisis. Right? They tend to not always recover in terms of potential income that they might make. Their views of the world of work are probably going to be very fundamentally changed by what they're experiencing at this time. Now, on the other side, we very much expect that there are going to be some very unique challenges of being an older worker during the COVID crisis. There are already challenges associated with being an older worker at work, especially for physically demanding jobs. However, now we're adding in the additional element of being in a high-risk group for the COVID virus. And I think there's going to be a lot of challenges with, feeling pressure, perhaps that they need to earn income, need to support a family. All those kind of things are going to give pressures to perhaps go to work, but then there's going to be questions and anxieties about being exposed to the virus.
Thank you. We have another question from an attendee who wants to know, can you elaborate more about the partnership that industry can take advantage of with academia, such as research assistance? Dr. Mejia, Dr. Shah, either one of you.
Yes. I don't know if Dr. Shah wanted to take it. Yes. So I can speak for UCF, Rosen College, and I think that other universities, other institutions across the country, globally, we envision ourselves as a direct link, an arm to industry. We're partners with industries, especially where we're located at Rosen College. And we belong to associations. We reach out and bring industry experts into our classrooms. We collaborate with industry experts on curriculum. And it's really a matter of going out into your local community or into your region, even at first, and making those efforts. And one thing that I've learned is industry people are very, very busy, and especially right now, incredibly overwhelmed. And as researchers and people in academia, maybe if we send something out, an email or a phone call or something, we must make sure that we're not tone deaf, right? We must make sure that we're appropriate to the moment, offering our assistance. And even if there is perhaps a no right now, we need to keep checking back. We need to keep supporting, but not just for the things that we want or need. Right now is the moment for industry. So we are here as a support. How can we help? In what ways can we help? Can we put together something and show you a one-page outline? In what ways can we be the support? Because that's who's hurting right now, it's industry, and we are here to support them.
Thank you, Dr. Mejia. Thank you, Dr. Shah. That's all the time we have questions for today. I just want to let everyone know who was attending that the video from this webinar will be available on the Rosen College YouTube channel later on today and tomorrow and going forward, so that you can go back and look at it. And we do hope to also have the slides available for you on the Rosen College website at hospitality.ucf.edu under the research tab of the Dick Pope Institute, so that you can go back and look at the data and make sure you do cite it if you do use it. We will be putting up that QR code as well on the website so that you can access it. And on that website, also, there is a link to the clearinghouse, the COVID-19 Resource Clearinghouse, so that you can access information that could possibly help you if you are in that furloughed worker category, or if you are a manager, an employer, someone who knows someone who could use the assistance from that resource. Also, right now, I can tell you that our previous webinars, and this is our fourth one, can also be found on the Rosen College YouTube channel. So you can go there and take a look at everything that we have presented thus far in research going forward. And it is all COVID related, and it is there to help the industry. I'd like to thank our presenters again today, Dr. Shah, Dr. Mejia, Dr. Wong, for being with us all today. I'd like to thank our attendees. We really appreciate you coming and listening to our webinar and getting all the data that we're presenting, and we hope that you'll continue to join us in the future. That's all for today. Have a wonderful rest of your Wednesday.